Once we've determined that you will be approved, the next step is to determine what your expected healthcare needs are during the year. So let's step back for a little bit here and just think about all the things that you normally spend during the year that are healthcare related. And let's assume that there is no health insurance involved here. And we're talking about just knowing how many times you go to the doctor, the specialist, what kind of prescriptions you're going to have, dental care visits, etc. So here are some of the major things that you want to take into consideration. Visits per year to the family doctor. So you and the rest of your family, how many times do you go to family medicine or doctors or pediatricians or for routine checkups and common illnesses? Okay, so and you can pretty well forecast that. Most folks tend to have to go to the doctor for 2 times a year, but maybe you have to go a little bit more. Maybe you have a condition that requires you to go every 3 months. Again, you just want to put everything down in terms of the number of visits that you have to do during the year. You want to take into consideration visits per year to the specialist. For example, dermatologists. If you're diabetic, you're probably going to have to go to the endocrinologist. And you're going to get woman exams if you're a woman. And then as well as some other procedures. For example, labs. You're going to get perhaps mammograms. All of those things you want to put down here. Something else that's being a little bit more common now are colonoscopies. Maybe that's something that you're going to be doing on a regular basis. Again, you just want to write all of that down. Prescriptions filled in a typical 12-month period. Again, if you're just simply getting sick and you need antibiotics maybe once, twice a year, great. If you're taking birth control pills, then write them down here too. If you have allergies, same thing. But if you have something that requires you to take medication on a more regular basis, let's say you have high blood pressure, well, then this is where you also want to write that down. Dental care visits, routine cleanings, X-rays. There might be some X-rays that you're going to need, especially if you're initiating with a brand new dentist. And perhaps you already know that you're going to have some dental work that needs to be done. Again, you want to put all of that down on paper. Vision care visits, routine eye exams, contacts, glasses fitting, anything like that. Again, you want to write it down. And lastly, alternative care. Perhaps having to go to the chiropractor, any massage therapy, acupuncture, anything that you, including supplements, for example, vitamins, etc. All of that you want to put in here because these are all things that are healthcare related, and this is what you're going to use to prepare a budget and have a good understanding of what your expected healthcare needs will be during the year. The next video will show you how to think about those expected medical care costs during the year and also to calculate them.